cancer of the large intestine or colon cancer. I'll just give you a brief presentation of what colon cancer is and how it is a preventable disease. You can actually prevent the cancer to happen before it becomes a fully cancer or it needs to be having a treatment. So just join me for 10 minutes regarding this presentation, and then all of us will give you the idea about cancer. Lack of physical activity, smoking and alcohol consumption, and red and processed meat is another area which leads to this. Colon cancer does not start as a cancer in majority of the time. It starts as a small polyp. That is an extra registered colon cancer, where about 2 lakhs in India with more than 50,000 deaths reported. These are official registry. Unfortunately, we do not have a very strong registry in India, so there are several deaths which do not go into the official registry. So we have a very large population and a high risk of cancer. Colon cancer actually is the third largest cause of cancer in the world and second largest cause of cancer deaths in the world. In India, we are changing our food habits, we are becoming more westernized. So there is an increasing incidence of cancer which is being detected. Younger and younger people are getting detected. About 20,000 deaths of the 50,000 deaths were less than 45 years of people who died during this period of time. So you can understand that cancer is increasing. We also are facing that younger population of cancer is increasing, and this is a cancer which should not happen, or we can prevent it. We know that we can stop this cancer from happening. And how do we do it is what we are talking today. Next. This is our intestine. It starts from mouth and till the end where we pass the motion. It's a very long tube. It's about 7-meter long tube which has it. But we are talking about the cancer of the large intestine, which is the colon. It is also called as a colon. As I just suggested, there were about. If we detect that tissue called as polyp and we remove it, we can prevent the cancer happening in this. How does it present? When it presents, actually, whenever the symptoms happen and the patient go to the doctor for these symptoms, by that time the cancer has become advanced cancer. This is usually seen by change in the bowel habits. Normally, if we are going for motion once, it changes to 2, 3 times, 4 times. Suddenly patients start getting a crampy abdominal pain and a presence of blood which is in the motion, which is a vital for diagnosis of this cancer. However, blood can occur due to some other common reasons also, so we need to differentiate what kind of bleeding we are having. I have just told about how do you reduce the risk of this colon cancer. You can screen for these colon cancer when you don't have a symptoms, when you are healthy. If you go and get yourself screened and find to have a polyp, polyps can be simply removed from your intestine. Apart from that, if you do the lifestyle changes, eat healthy meats and limit alcohol, you can do that. What are the screening tests? How do you screen it? I am telling about screening. There are very simple tests. You can test your motions for a blood which is not visible with your eyes. So this is to be tested by a lab. There are 2 types of tests called as fecal oral blood test and fecal immunochemical test. This, if we do it once in a year after 45 or 50 years of age, then probably you will come to know an early sign that you are having a cancer. Any cancer, when they start developing, they grow rapidly, and the blood vessels also grow rapidly. That's why chances of bleeding increases, and we can do that. And definitive or confirmatory test is what we call it as colonoscopy. Can you? While we depend on doctors to observe this and detect it, we also have a new way of detecting it, that is using an artificial intelligence and increasing the chances that artificial intelligence using a detection of polyps in these circumstances. We keep on passing the tube till we see the entire intestine inside. This has an advantage that if you find the polyp, you can remove the polyp in the same sitting when you are actually doing it, and you can see the entire polyp. This is just an example of how you remove this polyp when you do a colonoscopy, so that before the cancers are formed, you can just remove the cancers from your body. As soon as you remove it, you don't need to take chemotherapy, you don't need to do the surgery. It is done. After that, you just keep checking it regularly whether that is redeveloping or not. And it's a simple procedure where you put in you put a snare or a metal wire across it, and with the heat, we just cut it around. To do colonoscopy, do all of us need to do colonoscopy? Not everybody. If you have new diet changes, fiber-rich diet should be taken. If you are obese, change your weight down to normal weight. Avoid smoking, avoid alcohol, avoid red meat. Excess of red meat will cause colon cancer. So these are some of the things, lifestyle changes, we can do it to reduce the chances of cancer.
Symptoms?
Then you have pile symptoms, bleeding ಬರುತ್ತೆ. ಆ bleeding cancer ಇಂದ ಸ್ವಲ್ಪ ಡಿಫರೆನ್ಸ್
ಸಾಮಾನ್ಯವಾಗಿ ಪೈಲ್ಸ್ ಆಗಲಿ ಕ್ಯಾನ್ಸರ್ ಆಗಲಿ ಸಿಂಪ್ಟಮ್ಸ್ ಒಂದೇ ಥರ ಇರುತ್ತೆ. ಈಗ ಕ್ಯಾನ್ಸರ್ನಲ್ಲೂ ನಮಗೆ ಮೋಷನಲ್ ರಕ್ತ ಹೋಗುತ್ತೆ, ಪೈಲ್ಸ್ನಲ್ಲೂ ಮೋಷನಲ್ ರಕ್ತ ಹೋಗುತ್ತೆ. ಎರಡನ್ನು ಡಿಫ್ರೆನ್ಷಿಯೇಟ್ ಮಾಡಲಿಕ್ಕೆ ನೀವು ಯಾವುದೇ ವ್ಯಕ್ತಿಗೆ ಮೋಷನಲ್ ರಕ್ತ ಹೋಗ್ತಾ ಇದೆ ಅಂತ ವೈದ್ಯರನ್ನ ಸಲಹೆ ತಗೋಬೇಕು. ಅಲ್ಲಿ ನಾವು ಸಾಮಾನ್ಯವಾಗಿ ಅವ್ರಿಗೆ ಫ್ಯಾಮಿಲಿ ಹಿಸ್ಟ್ರಿ ಇದೆಯಾ ಅಥವಾ ವಯಸ್ಸು ಮೇಲೂ ನೋಡ್ತೀವಿ. ತುಂಬ ಚಿಕ್ಕ ವಯಸ್ಸಲ್ಲಿ ಸಾಮಾನ್ಯವಾಗಿ ಅದು